Hello and welcome to our lecture on Diabetes Mellitus type 2. We'll start off by talking about normal response of pancreas to food intake. Then we'll move on and cover the pathophysiology of Diabetes Mellitus type 2. After this, we'll shift our attention to the symptoms associated with this disease. And finally, we'll finish off by briefly mentioning a complication most commonly seen in type 2 diabetes. So let's get started. Type 2 diabetes mellitus is seen more often in adults. However, recent data shows incidence of type 2 diabetes is also rising amongst younger population. In this condition, your body develops an increased resistance to the hormone insulin. Some high-yield risk factors include obesity, which causes downregulation of insulin receptors, thereby requiring more insulin to achieve the same effects. Genetic predisposition in type 2 diabetes mellitus is greater than type 1 diabetes mellitus. Environmental factors like sedentary lifestyle or eating junk food can also lead to type 2 diabetes. We'll first look at the normal response of the body to the rising blood glucose levels. And after that, we'll see how it gets altered in type 2 diabetes. So when you consume food, your blood glucose levels start to rise. This stimulates the beta cells of the pancreas to release hormone called insulin in response to hyperglycemia. Insulin then functions to increase glucose uptake in most cells of the body, especially the liver, muscles, and adipose tissue. This, as a result, reduces the total glucose levels in the blood and brings it back to normal. The glucose taken up by the cells gets stored and is used later on when your body needs it, especially in states of starving. Let's look at how this process is altered in type 2 diabetes mellitus. So again, when you consume food, your blood glucose levels start to rise. This again stimulates the beta cells of the pancreas to release insulin in response to hyperglycemia. Now, the problem here is that there aren't enough receptors for insulin to act upon. This increases body's resistance to the hormone insulin, and glucose levels are not controlled the same way as it would be in a normal patient. Therefore, to compensate this, the pancreas initially tries to pump out more insulin in order to make up for few insulin receptors present. This will be sufficient enough to keep that blood glucose levels within normal limits. So like I mentioned in the previous slide, beta cells of the pancreas undergo hypertrophy and hyperplasia, so it can pump out more insulin in order to keep that glucose levels normal. In doing so, amyloid deposits build up in the pancreas, which can be seen on histology. Amyloid does not really have a significant function. So anyways, as the disease progresses, the beta cells eventually burn out and atrophy, finally losing all their ability to produce insulin. This decreases the total insulin levels in the body and causes hyperglycemia. And from this point onwards, the patient starts experiencing symptoms associated with hyperglycemia. Let's discuss them in the next slide. High glucose gets filtered by the kidneys into the urine, causing Glycosuria. Since glucose is osmotically active, during its filtration by the kidneys, water follows glucose. So in addition to Glycosuria, you get increased water loss from the kidneys as well. This increased urine output or polyuria can in turn dehydrate the person, urging them to consume more water, also called Polydypsia. Symptoms center to moderately low insulin levels. Again, it's moderately low, not completely absent as we saw with type 1 diabetes. This will become important when we'll discuss life-threatening complications seen in diabetes like diabetic ketoacidosis and hyperosmolar hyperglycemic state. Anyways, even when glucose levels are high in the blood vessels, it cannot be used by the cells for energy because of low insulin levels, so the cells of the body starve for energy, and as a response, protein breakdown occurs in the muscles to release amino acids, and fat breakdown occurs in the adipose tissue to release free fatty acids, and both these metabolites can then be used to generate energy. This eventually leads to weight loss, causing the patient to feel hungry, and as a result eating more food, also called polyphagia. There is one life-threatening complication seen more often in type 2 diabetes mellitus called hyperosmolar hyperglycemic state. It's usually seen in elderly with reduced fluid intake. Diabetic ketoacidosis is also a life-threatening complication seen more often in type 1 diabetes mellitus, and it arises when insulin is totally absent. In type 2 diabetes, however, the pancreas still produces a small amount of insulin, so diabetic ketoacidosis is uncommon. We'll cover both these complications in detail in a separate video. I just thought of mentioning them here for completeness sake. So that's all for type 2 diabetes mellitus. I really hope everything made sense, and if you found this video helpful, please give it a like and comment down in the comment section below. And please make sure to subscribe to our channel.